Good morning, Professor Popescu. Very nice to have you with us today. I'm very happy that you have accepted my idea to have a dialogue with you about healthcare. I see that you are in doctor's suit, probably in the hospital,
Yes,
but
definitely.
working hard as usual. I think everybody in this country knows who you are, a pioneer of many of the developments in the Romanian healthcare and a true leader of the Romanian healthcare, which I think to be a leader of the Romanian healthcare was never an easy task. It is a nice title with hard work, I guess, no?
Well, it's a long story to explain what you say, but maybe one day I will try to do it.
Yeah. Well, you know that we at MediHelp are trying to give some information and some service to our customers. Mainly, everybody wants to know what will happen, what will happen with their lives, with their economy, with their daily worries. And obviously, you and I cannot give answers for everything. We are not able to see the future. We don't read in coffee and not in cards. But perhaps in this conversation, we can do something in order to try to project the situation of the healthcare in Romania for the foreseeable future, maybe not too far away, let's say a year or two. As we know, we've already arrived to this crisis with many problems, and we would like to know your opinion about the next 12 months. What will be the relationship between the Romanian government and the system of health, the public system of health in this country? Can you somehow try to help us understand better what can happen and what will happen?
Yeah, I will try at least. Of course, no one can give a complete answer and the final answer to this question, but I will try to make some points. Uh, as you know, health is a very, very sensitive issue for the public, for the population. And since the population is voting and we are going to have elections, we went through a process of local elections and then we'll have general elections. The politicians are very, very much aware of the importance of healthcare. Uh, so, therefore, I think they will make all the efforts to keep the system in as good as can be kept with the budget that we have, with the human resources that we have, with the number of hospitals and hospital beds that we have. But like this, I think that realistically, all the efforts will be made to keep the system in good shape. It's not enough, as you know. Good intentions, we can find all over, but results, it's a bit more difficult. Um, Regarding the current model, as you know, is uh, well, it's a mixture. I won't say that the system is very well defined right now. It's this combination of public and private system. The private system brought a lot of value to the healthcare in Romania in general. Uh, Made somehow the task of the public system easier. The problem is that, and in the public discussion, this was emphasized recently, that ministry is no longer in charge of the whole system. Hospitals, for instance, some of them belong to the local authorities. They do not belong anymore to the Ministry of Health. But all in all, there are mechanisms to coordinate at a central level the whole system. And from this point of view, the government will infuse money for sure. Looking at the hospitals so far, I won't say that we miss like before, so devices or new technologies or things like this. in my personal opinion, the level of supplying this in the hospitals and in the system in general, it's decent, at least decent. One problem will be maybe regarding the medication and access to the medication. This is a big problem already. I saw it personally with a friend of mine. We all know it, that person was in need of remdesivir and there was no remdesivir. And then we realized that it's a public phenomenon, not only in Romania. So access to the medication could be a problem. Government, for sure, it's eager to invest, it's eager to buy, but we may in the strange position to not to find sources of supply. Then it's this balance between the pandemic, which is the main target, and everybody is focused on the pandemic and how we deal, what's the number of deaths and number of ICU hospitalized people and things like this. But already the discussion started months ago about what is going to happen with the chronic patients. Chronic patients, I operated 1 month ago, a colleague of mine with a severe disease, with an abdominal cancer. So they have to be treated. They have to, we have to take care of them, of the chronic diseases. And it's not an easy combination because it's quite clear that the access to the hospital is restricted. Maybe not officially, but if you ask all the hospitals in Romania about the number of admitted patients, about the number of procedures, you will see that there is a clear difference between 1 year ago and now. Still we have to deal with patients with cancer requiring operation, with emergencies, not to speak. Emergencies, usually they were clearly solved and admitted in hospitals, operated, things like this. But other chronic diseases that the decision that those patients can still wait, it's very difficult. Sometimes the patient make it easier for the doctor because many patients are afraid of COVID, so they decide not to come to the hospital despite the fact that they don't feel good, that they have symptoms.
Also carries a risk because some of them will not be treated on time and not be treated right, and might arrive to medical care somewhat late. There is also a danger in this.
Right, and so I can give you an example from this hospital. Was a patient of mine that was admitted for liver cancer. It was not easy to find a place, a bed in the hospital. Finally, we found such a bed. He was admitted. Then it was not possible to operate him because so the blood supply, it's a main problem. It's a difficult problem to solve in Romania. And we have to postpone the operation for 1 week or something, maybe more than 1 week. Meanwhile, he got infected with COVID because another patient in the same room was infected with COVID. Then he's treated under treatment with COVID, but his cancer is still there. So we are not able to solve the problem for his main problem. And this combination, which means access to a hospital bed and to an operating room and to get operated for the patients requiring operation, and COVID problems, for sure creates, makes the results somehow worse than before, has an influence on the prognosis of the patient. And that also may create a sort of psychology problems, not, don't dare to say psychosis in the population, that from this combination of difficult access, delayed treatment, and COVID problems can influence in general the health system and the healthcare system and the state of health of population?
The answer that we have for this in MediHealth, with the health insurance plans, of course, we cannot change the reality in the health system. Health insurance company is not supposed to be doing anything in terms of the national priority or the national system. We cannot and we will not, although I'm in touch with some officials in the country regarding healthcare issues, and I'm putting my opinion about the necessity of growing the private healthcare system that maybe is directed to people who can afford to pay for it, or they have private health insurance, but at least they take their own responsibility on their health, and that can represent some relief, like you said, on the public budget. However, we are also saying to our customers that if they cannot get a bed in a hospital and they cannot find a solution imminently where they need, then we offer them, according to the terms and conditions of our insurance plans, a possibility to be admitted to hospitals, to private hospitals in high standard in other countries. That is also a little bit tricky because some countries would not accept people from Romania, as Romania is not a green country, and green in terms of the COVID numbers, of course, otherwise it's very green. But of course, we are helping our customers to reach medical care if there is a case that needs private attention, which is impossible to find in this country. Then we have solutions in countries who are willing to take Romanian citizens, or countries, even if they have closed borders, tend to accept medical cases if they are on an urgency mode, not to talk about emergency. So sometimes we have this type of approach to some patients, but of course, I think that looking forward and taking into account the things that you said, would you not recommend to the Romanian decision makers to give a boost to the private healthcare growth and to encourage, because you know in the last 20 years, the speed of growth of the private healthcare in this country was not booming. There were some nice developments, some big chains, some private hospitals, but per capita, and if you compare to the size of the population here, it's not a very, very booming industry. And the growth from year to year is not shocking, let's say it like this. I'm interested to know if, in your opinion, the Romanian government should or should not, by investment benefits or by tax reliefs, encourage private healthcare to grow and public and private health insurance to support it. Because sometimes it can be a very expensive exercise to afford private care in private hospital, but the insurance plan can ease you up. Interested to know what's your opinion about this.
Well, you mentioned the fact that the private sector in Romania develops slowly and not at a very large scale, and this is true. But fact is that we have to take into account the financial power of the Romanian citizen, and from this point of view, still, in my view, the most important thing is to give the population the possibility to get treated somewhere, to have a solution, sometimes for difficult problems or for emergent problems. This solution can be expensive. If this is expensive, so there are people that have the money, it's not a big percentage of the population, but still there are people for this. There are people that, for many reasons, you know what is the mentality when somebody is facing a serious health problem. They can find resources in the family, among the relatives, the colleagues, and things like this. They finally can have the money and are eager to spend them to solve the health problem. And people that cannot afford at all. From this point of view, insurance, of course, it's a good way, it's a good coverage, because reality shows that there are many diseases that someone can get unexpectedly. I have among my friends, so example of such examples, and then you can face a major financial problem. This is not the case only here; it's the case all over. The three categories that I mentioned, so people already having the money, people able to get the money somehow, and people that cannot make it anyway. The coverage of a private insurance can be an additional comfort for someone. So somebody going every day to his job or her job, working hard to get a salary, but having this possible spectrum of disease in front, which might be a serious blow, including a financial one, would feel a bit more relaxed if he or she has a private health insurance, because this money is spent, I would say, most wisely. So we all depend on our jobs, or our capacity to work, or our capacity to function. And whenever we make our accounts and we decide how to spend the money that we have, I think one of the priorities to take into account is to keep alive and to keep going our capacity to work. And from this point of view, the more we have a good coverage, more our personal comfort and our personal approach to work and to life in general would be better. In my view, in modern life, health coverage, except the public one, becomes more and more a must. And as you know, this is not for usual spending. This is not for dentistry and for minor procedures and for minor treatments. This is for catastrophic events. If these catastrophic events don't happen, even better, it's wonderful. But if they do, then at least in the catastrophe that such a disease can bring, we have at least the comfort that we are financially covered, and that we'll have a very good care, the best care possible at this moment. And one more thing, as you said, now it's not only the cost of the procedure, it might be also access to the procedure, because access becomes a problem. And if the private insurance helps also in terms of access to the healthcare system somewhere, not only here, wherever, a patient with a severe disease, especially, it's very eager to get treatment wherever. The place doesn't matter anymore. The fact that it's someone able to solve the problem and to take care of his or her disease, it's the most important thing.
Yes, I of course agree with everything you said, because we are trying to mobilize the awareness of the Romanian public to the big necessity of having health insurance, also as a part of taking the responsibility over your health, because there is this old attitude that my healthcare is the responsibility of the state, and I think that this is slowly changing, and I'm very, very happy that we have a part in it. My last question, on a personal note, I'm sure that you are seeing the young generation of the Romanian doctors, those who are coming to work with a higher risk of being exposed to the virus, but they still need to take care of the patients with the virus and without the virus. Some of them are in isolation and unable to come to work because they have been either suspected or confirmed as sick people. So I think that your system is probably even suffering more from a shortage of manpower than before. And when they look at you as one of the leaders of the system and as an icon, and they look at you asking, are we in the right place? Have we chosen right to become physicians in the system that is so difficult? What do you tell them?
It matters what me or my colleagues from the old generation tell them, because we always encourage them, and we try to give them good advice in this situation. But more than this, it matters that the intrinsic, the personal profile of everyone, because I think in such a difficult period, more than ever, you can discriminate between those that choose the profession, the medical profession, because they really want to help people, and the others that choose the medical profession for many other reasons, including fame or salary or whatever. In such a, this is more or less a war situation. I mean, it's comparable in many regards with the state of war, and in such a situation, the personal profile and, as I said, this desire to help other people, it's the most important thing. It's the thing that matters most. And some people from the young generation really have it and go there and expose themselves to the virus and confront the virus, but they keep going and well, making their job, and others that are reluctant. Thank God, I would say that the percentage is much more in favor of the first category. Most of the young doctors, so they, of course, it's the enthusiasm of their age, characteristic for the young age. They go there and they are eager to confront the disease and to take the challenge. Some of them got infected. Again, thank God, the infection, in, as you know, in the young generation, they make somehow easier forms of disease, so not very severe, but still some of them, we have even death among the people from the young generation. Still, the general evaluation of the way they confront the pandemic, it's positive. That shows that most of them choose the medical profession for psychological reasons or intrinsic reasons, and not for social reasons or financial reasons.
For selfish reasons. Yeah. Well, talking about enthusiasm, I'm always enthusiastic to talk to you. The conversations with you are always very interesting. I want to thank you very, very much for spending time with me this morning and for sharing your important opinions and your important views with the MediHelp customers and MediHelp team. And I'm looking forward for more conversations like this down the road.
Me too. All the best, and I wish you good luck in this difficult period.
Thank you very much. Same to you. All the best.